How will I know which procedure is right for me?
Choosing the right surgical procedure for you can be challenging, but I like to think of it as a choice of several good options. So you've got the gastric bypass and the lap band, which are well-established operations, and the gastric sleeve, which is a newer procedure coming up on the horizon. The vast majority of patients that we see who are thinking about surgery can be completely successful with any of these. But as we'll learn about, there are significant differences between them, mainly differences in how you as the patient works with the operation. And since it's so important in the whole weight loss process for you to be an active participant, to work with the surgical procedure, I really think it's important for you to have a favorable sense, a positive sense of conviction about the operation that you choose. So mostly we're going to want you to learn about the surgery, and we're going to want you to choose which operation we do, with just a couple of exceptions based on some medical criteria.
What are the determining factors for whether my surgery will need to be done laparoscopically versus an open incision?
Good question. Mostly these days in New Dimensions, we do surgery laparoscopically, so that at least 95% of our operations, whether it be the gastric bypass, the band, or the sleeve, 95% are done laparoscopically. And right now, not even weight really stands in the way, as long as we and the patients work together to get the weight down and get you prepared properly. So that small subset of patients where we would not do it laparoscopically mostly are patients that have some other type of abdominal situation, such as extensive surgery before we go on to do the weight loss operation. So odds are laparoscopic.
After the bypass surgery, where does the digestion occur? And will I lose any of my functions, any of the functions?
With all the operations that we do, especially the gastric bypass, but also the band and the sleeve, absorption of foods and medicines is basically normal. And where that happens is downstream in the small intestine, where the food and the digestive juices mix. And that part of the digestive system is not disturbed or changed with any of the operations, and that's where most of the digestion takes place.
How much will I be able to eat after surgery? And the sugars, are there any sugars that are going to be okay for eating after the surgery?
People eat very, very little in the early time frame after surgery, and that's because of the surgical trauma that we induce on the stomach. So just naturally, when we staple on the stomach or suture on the stomach or put a band around the stomach, you're not going to be hungry for a few weeks. And that's a great thing. We call that the honeymoon period, and that's the time that you're going to lose weight very rapidly and very easily. What I really like to talk about in answer to your question is what happens a year after surgery, or 2 years, or 5 years after surgery. And for all the operations, I like to describe it as eating similar to a 6-year-old or an 8-year-old kid. And that means a lot of different things. That means that some days you eat big and some days you eat little. It means that you eat regular people food and it's not special processed food. It means that you can function normally, socially. You can go out to restaurants. You can eat stuff that you're not supposed to. Okay, so that's a real thing that you need to watch out for down the road. If you're a 6-year-old, you've got mom or dad watching out to make sure that you eat the nutritious stuff. And as a weight loss surgical patient, you have to watch your own diet and be in control of that. Does that make sense?
Totally.
So, cool.
What can I do to reduce the risk to having weight loss surgery?
I'm really glad that you're asking about how you can control your own risk going into surgery, because you can control your risk to a really significant degree. When you meet individually with your surgeon's going to talk to you specifically about what you can do as well, but everybody's going to need to lose some amount of weight. Some people that's 5 pounds, some people it's 35 pounds. Your surgeon's going to give you very specific instructions and guidelines. We think it's a great idea for you to practice walking and try to get your body in a little better shape before surgery. We think it's a great idea if you practice taking the vitamins and the supplements before the surgery. We think it's also a great idea if you start the diet before surgery, which fits pretty well with the idea of trying to lose some weight. So those are the things that are the key about getting ready. And we like to think of this as a really big event day in your life, as if you're an athlete preparing for the Olympics. They train like crazy, right? So this is also going to be a pretty important event in your life course, and it makes a lot of sense for you to get prepared in the same way.
Good. What happens to the lower part of my stomach that is bypassed?
Yeah, the diagram that we use for this surgery makes it look like that lower part of the stomach might twist around or fall out or die off or something like that. And so that's a great question to ask. The good thing is that when we do the gastric bypass surgery or any of the operations, we're leaving the blood supply to that stomach and all the tissues still intact and functioning. And so that tissue remains healthy through its normal blood supply. And that blood supply is also what holds it in place and keeps it from doing anything funny like twisting around.
What about insurance coverage?
First of all, as physicians taking care of morbidly obese people, we really feel very strongly that this is a real serious medical issue. It's not something that patients are choosing to do to themselves. It's a biological issue, and so really every patient who's medically appropriate who wants to have the surgery ought to have it covered. That's not the current situation, unfortunately. And so what you're asking is, how do you learn if you're covered or not? And the key thing to do is to go with your employer or spouse's employer, however it may be, and look at the benefits book, and there's going to be something about obesity treatment in there. If you can't find it in that benefits book, then call the insurance company and ask about it. But the key thing on this is, don't take no for an answer. A lot of these people are taught to say no the first time, the second time, and the third time, and so you want to be very persistent. And really, on this insurance question, we try to encourage patients to feel entitled to what they deserve in terms of proper medical care. And proper medical care isn't just what I do and the rest of the team does. Proper medical care is proper financial support for you to become healthier. When you make this really courageous choice to go into the surgical procedure, you're making a choice for the future that nobody's going to make you have. You're making a commitment to go on to lifestyle changes that are going to last for life, and you're making a commitment to better health. And it ought to be the case the insurance company supports you with that, so don't take no for an answer the first time around. Now, as you both know, sometimes no really is the final answer, and in those cases we do have financing options for people to try to make it a little bit easier to pay for this one way or another. But we really want to try and exhaust every avenue that we have to get health insurance to cover this on a medically proper basis before we get to your pocket.
Will I have to change any of my medications?
Great question on the medicines. First of all, absorption of medicines with all the different procedures is pretty much normal. There might be one or two things that we need to change doses on. Now, there will likely be some significant medication changes for you after surgery as your weight comes down, and that is the category of medicines that you won't need anymore. So we're pretty much for sure going to get rid of diabetic medicines. Very good chance that we'll get rid of high blood pressure medicines, especially fluid pills and diuretics. Very good chance that we'll get rid of cholesterol medicines, and some other medicines that are common like thyroid medication or depression meds will need to continue, and there might be slight dose adjustments on those, but not any big changes, and we'll monitor those with you and with the help of your primary doc.
Excellent. How is pain managed?
We really are very interested in having your pain under good control so that you can be up and moving around. So I can't say that you'll have zero pain, that's not fair. But what I will say is that your pain's going to be well controlled so that you can breathe well and walk and things like that. And the way we get there, depending on the surgical procedure, is that we're going to use a combination of IV medicine, and quite likely you'll have a pain button that you can push. Some nerve relaxing medicine, which is called Valium. That's a pretty familiar name that helps out a lot. And also in many cases we'll use a little pain ball, or actually it's an anti-pain ball, that will trickle some numbing medicine into some of the main incisions and help control the pain in that way. So pain control is a big key for us, and we'll get there depending on what you need.
What kind of follow-up appointments are going to be required post-surgery?
The schedule of follow-up appointments is a little bit different depending on which operation you have done. If you have a gastric bypass or a gastric sleeve, we'll see a patient at 2 weeks after surgery, and then about 1 month later, and then a little bit more spaced out after that. On the other hand, if a band operation is done, we need to see patients much more intensively in the first 2 or 3 months after surgery, because it's during those follow-up appointments that we're doing the band adjustments. So once we begin the band adjustment process, we're seeing the patients pretty much every week to do an adjustment, or also what we call a fill for the band. Once the band gets to the right level where it's tuned to that patient, then we pretty much see patients every 3 or 6 months and then space it out to each year, like the band, or I'm sorry, like the sleeve and the gastric bypass.
After the surgery, how much exercise should I do?
As far as exercise after the surgery as well, when the surgeon sees you at your first appointment after surgery, the odds are very high that the surgeon is going to clear you for doing any kind of physical activity. And the key thing is that the small incisions that we use become strong very quickly. So as a patient, there's very little that you could do to damage yourself after the operation. And because exercise helps a lot with your energy level and your weight loss, we're going to want you exercising as soon as you can stand to do it after the operation.
Is pregnancy going to be a possibility after gastric bypass surgery?
If you're a woman, it's okay to get pregnant after this surgery. Actually, seriously. We don't want a person to become pregnant while they're losing weight rapidly. So definitely women should use very reliable birth control within the first year after surgery. But after that, and once their weight is stable, and as long as their nutritional status is okay, and as long as they want to, it's fine for a woman to become pregnant after surgery. And I personally, in my population of patients, have had 60 or 65 healthy babies delivered in my own patients, and it's been really, really cool. So it's a wonderful thing.
Oh,
yeah.
That's great.
With my size, am I going to have problems in the hospital?
All of the hospitals where we do this operation are hospitals that have created specialty areas and specialty staff and specialty equipment to handle people that have really significant obesity problems. And so yes, you are going to fit in the bed, and yes, the gowns are going to fit you without your rear end hanging out, and yes, we have the instruments that can handle the surgery and issues that may come up during the operation as well. And yes, the staff are going to be accustomed to taking care of people of your size, and their eyes aren't going to go like this when you come in the door, I promise.
About how much weight can I expect to lose?
Weight loss does vary between the band and the sleeve and the gastric bypass. So what I can say is that for all of those procedures, when you get to the final settling out weight, when you're stable, most people will have lost significantly more than half of their excess. Well, what does that mean? What that means is that you're going to lose down to being, on average, maybe still 30 or 40 pounds over your ideal weight. Okay, now the ideal body weight is not really a good goal for you medically, so for most folks we consider that to be okay. The rate of weight loss is definitely different between operations. The gastric bypass makes people lose weight very rapidly in the first 3 months and then more slowly over the next 9 or 12 months to settle out at about a year, maybe 15 months after surgery. The sleeve is very similar, although data is still coming into play about how the sleeve works in terms of the pace of weight loss. With the lap band, the weight by design is lost more slowly and gradually and steadily. So that we try to make it so that a person loses 1 or 2 pounds per week up to maybe 3 years or so after the surgery before they settle out. So the gastric bypass and the sleeve are quicker, the band is slower, but they end up in almost the same place at a dramatically healthier lower weight.
After a substantial weight loss, how do you address the residual loose skin?
One problem that patients run into, the more successful they are with weight loss, the more loose skin they're going to have. Unfortunately, the fat over years has expanded your skin and stretched it out. Your skin does still have some ability to snap back in, but that elasticity, that stretchiness fades over the years. So if you're on the wrong side of 40 years, like I am, then probably your skin doesn't have all the snap that it used to have, and as your body deflates, you know, the fat goes away, everything's going to pretty much fall. And that can be your belly, your butt, your boobs, your arms, and those kinds of things. And so for most people who are really successful in weight loss, it's useful to have some skin removed surgically at a later time. We like people to wait until their weight is stable after the surgical procedure is done. So for most people, that's a year to maybe 18 months after surgery. And definitely we as your bariatric team are going to want to see you and check you out from a medical standpoint and make sure that you're ready to go on to that next surgical procedure.
How about my beard, Doc? I didn't get like this, you know, strictly by food. I drank a lot of beer and alcohol. Am I going to be restricted from having that enjoyment for the rest of my life?
You know, first thing you touched on is really important, is that alcohol does have a lot of calories. So you need to know when you're drinking a beer or a glass of wine that you're taking in some calories that have zero nutritional value. Now, as long as you realize that and keep it to moderation, then yes, you can have a drink or a glass of wine here and there. You want to stay away from drinks that contain a lot of sugar because that can cause dumping. So strawberry daiquiris and pina coladas are pretty much out. But a beer here and there, a glass of wine is usually okay. Now, recently there have been a lot of concerns in the media and in society about this addiction exchange problem, or people becoming alcoholics who had weight loss surgery. The medical and the surgical community have seen this happen in a few cases here and there, but honestly it seems like that's getting blown a little bit out of proportion, and it's really not a common problem. The key thing is to watch out for alcohol as it relates to calories and as it might interfere with your weight loss.
Why do I have to wait? I'm ready to do the surgery now. Why do I have to wait for the surgery?
Yeah, I wish we could do your surgery tomorrow, but I'm booked. No, seriously. Everybody who chooses to go through this surgery is going to need some preparation, and there's two parts of that. The simple part is, medically, we're going to want to look at you individually and find out what you need to be ready. And I mentioned some weight loss, but there may be some other things like testing for sleep apnea or having a cardiologist evaluate you, things along those lines. And that part makes good sense to surgeons and patients and everybody involved. The part of the delay that might not make sense, but it's usually necessary, is the insurance delay. The insurance company is going to want their own set of things to be done before they will agree to cover the surgery. And you know, as docs, definitely, we wish that they would trust us when we say that someone is medically ready and appropriate for surgery, but they don't with this particular operation. And so it's going to be necessary in most cases that we do some extra legwork for the insurance company as well.
I have another question, Doc. How about smoking a cigarette? Am I going to be, is that taboo? I can no longer smoke cigarettes?
Smoking is a terrible habit. Definitely prior to the surgery, you absolutely must not smoke. Smoking doesn't only interfere with your lung function, smoking also interferes with blood flow so that you have a 10 times higher chance of infection, 10 times higher chance of a leak from your surgery, 10 times higher chance of forming blood clots because smoking tobacco interferes with the normal blood clotting system. So it's awful, and it's completely not doable, it's not acceptable leading into surgery. Now, if you smoke after the surgery, I still think it's poison, I still think it's bad for you, I'll still cluck and frown, you know, but it's not gonna be something that I can hold over you in any way. It's definitely a bad thing though.
For more information, please call or visit our website.